There are moments that I wish I could just go back in time and knock some sense into myself. This video, guys, we're talking about the ways that being a parent has made me a better pediatrician. I will definitely say that I went into pediatrics because I love children. Naturally, I couldn't wait to become a mother, but it's completely changed the way I practice pediatrics in many ways, especially from the parenting perspective. Hi everyone, for those of you who don't know, my name is Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. So today I'm reflecting on how becoming a parent has made me a better pediatrician as I soon become a mom to 2 kids. Now, one thing I know for sure is that I learned a lot becoming a parent, and even now, becoming a parent of 2, I'm still trying to absorb cues. I've actually talked to my patients about how they prepare their older children to become siblings. I've actually talked to my parents of 2 to 3 kids about how they potentially handled doing the newborn feedings with another child. So I think there's a lot that I can still continue to learn in this field, but some of the big things that step out to me right off the bat would be some of that antiquated advice that I always heard that we totally know is not always practical. For example, when it comes to breastfeeding, I was a resident who was pretty comfortable talking about breastfeeding and had a good understanding and foundation of breastfeeding, how it works, the physiology, what the common concerns are, troubleshooting them, etc. One thing I never really understood was why moms didn't just pump. For me, my doctor brain, it was so easy with pumping to think of numbers and then being able to time things appropriately. Well, when you pump, you know you make this much. And it's so nice to know exactly how much your baby is drinking, and then you can time your feeds just right. Well, yeah, the concept of it sounds really great, but practically, pumping can be really hard. I myself didn't really know any of the pump parts. I didn't know what it really takes to sit down for 15 to 20 minutes uninterrupted and try to pump, especially if you don't have a hands-free pump. You're basically glued to a chair. And not to mention the agony of potentially exclusively pumping. Once I became a mom and really got immersed into that whole world of pumping and even having to exclusively pump for my daughter who wasn't latching, I had so much more empathy, especially for moms who are doing triple feeds. So if you're not aware of what triple feeds are, it's actually something we use for some babies who are potentially lower on the weight curve or potentially preemie babies, or a mom who's trying to make her milk come in and still support nursing at the breast for her little one. So it's feeding at the breast, then pumping, and then feeding your baby that pumped milk. So triple feed. That is a really long, drawn out concept. And it can take an hour plus just to do the feed. And then if your child is cluster feeding, well then it kind of feels like you're doing that 80% of your entire day. I had no idea about what really went into pumping and breastfeeding and trying to feed your baby until I was actually a new parent doing that. Speaking of other things that I used to say, feed the baby when you see their hunger cues. Yes, feed the baby when you see their hunger cues. But make sure you feed yourself too. I mean, how many of us have sat down when we see those hunger cues and we're so proud of ourselves, we caught the baby before they get hangry, and then we realize we're hungry or thirsty. So a few things that you could do. Make sure you either have stations set up around where you usually nurse, like snack stations that have a water bottle and a few snacks. And I actually mentioned this in my tips for success when it comes to breastfeeding, so make sure you check out that video here. Absolutely, just take the extra 20 seconds and ask somebody to bring you a snack, or grab something really quickly that you can eat with one hand while nursing your baby. Okay, so feed the baby, yes, but make sure you feed yourself as well. Because we all know, especially in the early days, you're gonna probably be sitting there for a while. I mean, I feel like there's like a butt-sized imprint of where you sit on your couch or your nursing chair or your rocker when you're nursing in the beginning days. Because it's a job, and it's something that everybody says breastfeeding is natural, but it does not come naturally to either you or the baby. It takes a lot of work. And if I could just go back in time and hit myself and tell myself these are things that you need to remember and coach parents on and think about in the back of your head, as the pediatrician, I wish I could. Again, ways that being a parent has made me a more empathetic and more proactive pediatrician. Now we talk a lot about snacks, right? For mom, let's venture a little bit forward into potty training. What about snacks and bribery and sweets and treats for children? I used to be that pediatrician that said, never, don't do it, bribes don't work. Well, yes, bribing can lead to expectations of something always occurring, but you can play the game a right way. Let's say you're potty training your little one and you're trying to get them to go number 2. Don't go out and buy a big toy every time they poop in the potty. No, you don't want to do that. Instead, play the game the right way. Maybe have a pack of stickers, or maybe buy like one of those canisters of cars, like those little toy cars. Every time your toddler goes number 2, you give them one of the cars from there, so that you're not really breaking the bank and also leading to unrealistic expectations just to get them to go in the potty. And the other thing is, be careful not to try to bribe them. So it comes from your words as well. So don't fall into the statement of, if you go poopy, you'll get XYZ. No, I mean, let them realize the reward system on their own. And again, once you realize that your reward system isn't really necessary, then try to take it away. You don't absolutely have to continue to reinforce that each time. Make sure you can pull it away easily. Even when it comes to small little rewards like M&Ms, I don't think these are the end of the world. Don't give your child a whole bag, but 1 to 2 M&Ms aren't a really big deal. Then as your child gets used to really going in the potty and they don't really need that sort of reward at the end, then stop giving them the M&Ms. Then you make yourself happy and the dentist happy. All right, and the last bit of advice that I feel like I wish I could just go back and like kick myself. It's sleep when the baby sleeps. Unless you can sleep on demand 3 to 4 times a day, this is really impractical advice. I myself, personally, when I had my daughter, I was a resident and I had a few weeks off at home. I would try to nap for maybe 1 nap, but I absolutely had to use the other naps just to shower. I had to use the other naps just so that I could potentially eat. So of course, I've definitely also eaten my lunch when I have the baby in the carrier in front of me and you get crumbs all over their head. Not an ideal situation, so you like to try to sit down and eat your food in peace as well. So how can you possibly catch up on sleep each time the baby sleeps? It's just hard. Not that you'll be stuck doing housework, but you just want to do daily lifestyle upkeep, like brushing your hair or brushing your teeth during that time. Not to mention, I'm pregnant, right? So that advice makes 0 sense right now. If you're pregnant with baby number 2 and baby number 2 comes along and you're trying to sleep when the baby sleeps, so then what happens to your toddler? Do they like burn down your house in the meantime? Who watches them? It's obviously not a practical piece of advice, but it's said so frequently. So I think that's one thing that approaching parents head on and let them know that you might hear this and it might work for you. I know some moms that it absolutely worked for, and some moms that totally agree with me that it is very impractical advice. Let them know. I mean, as a pediatrician, I try to do that really early on with my parents and let them know that this newborn period is hard. Nobody's going to expect it to be easy, and some of the advice you hear might be unsolicited and it might be unhelpful. But these are just some of the many ways that I feel like being a parent has made me such a better pediatrician. And sure, I think maybe in the other way around too, being a pediatrician has made me a better parent. I'm maybe a little bit better focused when it comes to toddler behaviors, expecting what's normal versus what's not normal when it comes to parenting, different milestones, how to progress when it comes to feeding, all of these different things. But I definitely feel like the reverse has made a much bigger difference in my life. Being a parent has made me a much better pediatrician. I hope this video was helpful. Make sure you give it a thumbs up, subscribe, and tune in next Monday for a new video.